I think you're going to find this a fascinating interview. This gentleman is a surgeon, Dr. Michael E. Arnoff, and he's from Kansas City, and he is here for a convention that just recently concluded. Doctor, I'm curious about the convention. What was it all about?
Well, this was the American Academy of Otolaryngology and Head and Neck Surgery. This is all the board-certified ear, nose, and throat doctors in the United States, and that whole group has various subdivisions. The main one I was concerned with was the American Academy of Otolaryngologic Allergy. In other words, it's ear, nose, and throat doctors who do allergy. There are other branches, facial plastic, head and neck surgery, hearing loss, ear surgeons.
I have a feeling we've had the cream of the crop in your field.
Yeah, these are gifted, famous people.
Including yourself.
I'm not very gifted, I'm not very famous, but I'm doing the best I can.
He's speaking that way, and it's very nice of you, but you also, you have so many facets of your talent. You also are, you give cosmetic nose jobs. I know that's not the correct term, but you don't do that for cosmetic reasons, but you have to anyway when you...
Well, we do it for reconstructive reasons. The main thing is we're trained, we have a 4-year training in surgery. This includes head and neck cancer surgery, mastoids, tonsils, and facial plastic. And go ahead, I'm sorry.
No, go ahead. I was just going to say you have become a master at your trade. Michael Jackson, I know there are other very, very famous people who have also had a nose job, but Michael Jackson comes to mind because it was a magnificent job. But you truly have mastered that art.
Well, it's part of the work we do. The main thing is, though, in my practice, I don't do just cosmetic. I try to do reconstructive surgery. In other words, if someone comes in with a deformed nose, what I want to do is get them to where they can breathe pretty well. And this is where the allergy comes in. This is what we were talking about in the past, is if someone comes in with a crooked nose that's very, very swollen from ragweed, and if you operate on that nose, they still won't have a good passageway because their nose is still going to be swollen. In other words, all surgery does is it rearranges architecture and it removes things, but it doesn't control the way the membranes react. So I found that since I started incorporating allergy into my surgical practice, I'm getting better results with surgery, plus I'm doing a whole lot less surgery. I'm realizing that surgery isn't always the answer.
Got it. I hope you don't mind me mentioning that you also have had a nose job, which is fascinating, because unless you would have told me, I would have never known it, and it is a beautiful job.
Well, I'm just a beautiful guy.
You've touched on the subject, which I'm sure many people are going to be extremely interested in, and that is allergies. And you are a specialist in the field, and this is quite fascinating to me because I've always considered this area highly pollutant, but that may not necessarily be so. It may be man-made, these pollutants we're engaged in. The common allergies people think of are what, doctor?
Well, when people think of allergies, they think of what they're advertising on TV for Dristan, right? They think of the stopped-up nose, the itchy eyes, the sneezing, the you know. There's more to life, there's more to allergies than stopped-up nose and itchy eyes. And when I see people, and they're coming in with the nasal and sinus symptoms, then I ask them about other things. And these are the things that people don't think about. I ask them about chronic fatigue, whether they have arthritis problems, whether they have mood swings, all sorts of funny aches and pains that you wouldn't associate with allergies, which may in fact be related to the food you're eating, or the chemical contamination of the food you're eating, or the chemicals in the environment. And when I say environment, I mean both indoor and outdoor.
Right. As you know, I had Dr. Randolph
Yes,
on recently, and that's exactly what we talked about, indoor and outdoor pollution. Is it getting so bad that everything we eat and everything we breathe is bad?
Well, it's not bad unless you have symptoms. Theoretically, it could be bad, but I don't think people should worry about what is bad for them if they're not having symptoms, because you can drive yourself nuts with this kind of stuff. The main thing is you have to live a full life, a good life, and people have choices to minimize the impact of their environment. In other words, if someone chooses to smoke 2 packs a day, then he's going to have certain problems that someone who doesn't smoke won't have. If you choose to eat a lot of junk food or eat a lot of stuff with sugar in it, then there's a certain amount of symptoms that are going to become part of your everyday life that you might not even associate with what you're doing. So the thing I'm talking about is diseases of lifestyle. You can change the way you feel by what sort of life you live.
Is that what you mean by food addiction?
food addiction is something that's hard to understand, but if I talk real slow and explain it to you, we can get through it in about 15 seconds.
Okay.
The main thing about food addiction is that people get used to eating a certain food. If the food, let's say sugar, all right? If the food is combined with a drug, then it's that much more addicting. In other words, there's a certain amount of sugar that's in cigarettes. When people smoke cigarettes, the tobacco is cured in sugar. Okay?
I didn't know that.
So why do people gain weight when they quit smoking? Because they're still addicted to sugar. They have to eating things with sugar in it. So let's use sugar as an example. You eat a certain amount of sugar. You drink, let's say, 6 cans of Coke a day, Coca-Cola. And what happens is if you don't drink it, you start getting withdrawal symptoms. Just like withdrawal symptoms from anything else. Just like from alcohol or from narcotics or anything else. So you drink the cola to relieve the withdrawal symptoms. And then you can become addicted to that. In other words, you feel bad, and then you drink the Coca-Cola to make you feel better. It could happen with corn. It could happen with wheat. It could happen with just about any food.
As a matter of fact, you said a lot of the cereals, your milk products, milk itself, sugar, it's bad.
It's bad if you're having trouble. I wouldn't say that milk is bad. I'm saying that a lot of people I see who have chronic symptoms, when they get off of milk, they feel a lot better.
And the last thing in the world they will attribute it to
is milk.
Is some of these products like milk.
These are vague symptoms. They're chronic symptoms. They come and go, and they confuse the patient, and they confuse the doctor. And the reason is because it's not like eating shrimp and getting hives. It's not like eating strawberries and starting to wheeze. These are chronic symptoms that are with you all the time. This is why it's not understood by a lot of doctors, because they don't associate one symptom with one event. It's a chronic thing. These items in your body all the time.
We have more topics to cover with the doctor. Please stay with us. We're going to take a break, and we're coming right back. Allergies. And, I don't know, maybe you're the wrong person I should be saying this to, being a doctor, but I can't imagine the amount of money a lot of people spend treating various symptoms for the wrong cause.
Well, I think one of the reasons that happens is because they come down with a symptom that, in other words, let's use an example. Let's say you have chronic bad headaches, okay? You go to see your doctor, your family practitioner, and they'll give you various medications for the headaches. They'll give you either pain medicine or a decongestant or an antibiotic, okay? Then the next step is you'll get some sinus x-rays to determine whether or not the sinuses are involved. And the sinus x-rays are usually negative. Okay, then they'll say, well, it's not a sinus problem. Maybe it's a neurological problem. They'll send you to a neurologist, get a CAT scan, get all sorts of different neurological tests involving either the circulation to your head or the muscles in your face, or whatever it is they think it is. Those are usually negative. Okay, then what happens? They say, well, how do you get along with your husband? and that right away starts giving her another headache. So they send her to a psychiatrist. And then when all that fails, after they've been to all those doctors, then I see them. They say, look, I've been to the psychiatrist, I've had my sinus operated on, I've had a CAT scan, I had a brain scan. Had a brain scan, they couldn't find anything. I said, I know.
Wow.
So then we start getting into what kind of food they're eating.
Got it. And now, I've heard about the skin tests. Is that how you determine what a person is allergic to, or if this symptom they have may be coming from a food or environmental problem?
Well, you sit down and you talk with them. You find out what's going on. If they have symptoms starting August 15th and the first frost of the year comes, they feel good, then you know it's going to be a seasonal allergy. And then in the spring, when the trees come out, then you'll know pretty much it's a seasonal thing. If it's an all-year-round thing, then it could be that symptoms all year round accentuated in certain seasons. So that leads you to think in terms of certain things. Now, what happens when they have symptoms that aren't that closely related to changes in the weather or changes in the season? In other words, now you're not talking just about sinus pain and pressure and runny nose and itchy eyes. Now you're talking about these other things, which is depression, fatigue, aches and pains. And then you start thinking about foods. You start thinking about the chemicals. So the first thing we do is we do the skin test, and this is a special kind of skin test. When people think of allergic skin tests, they're thinking of scratch tests, these old scratches that the docs used to do on your back. These tests in general are not very accurate. They're done by a lot of doctors today, but the most up-to-date, most accurate method of skin testing is called intradermal antigen titration. In other words, we use different concentrations of the same antigen. When I say an antigen, I mean ragweed or dogs or cats or trees. And that way we use the patient's skin as a control. You use the patient as a control to find out what the right dosage is for him. It's reliable, it's predictable, and above all, it's safe. It's not dangerous. You're not going to throw somebody into a big reaction.
Do all doctors use this, or
No,
as you said before, various kinds?
The doctors who use this are the doctors that belong to this group that I'm associated with, which is the American Academy of Otolaryngology Allergy.
Do we have that kind of a particular doctor in Las Vegas, or are they scattered throughout the country?
They're
like
all over the place. I know there are 2 or 3 at least very good doctors who do that in Las Vegas.
Fascinating. I wanted to mention this diet diary, your symptom diary. Is this something somebody can do at home?
Yeah, anybody.
Thanks. Go get him, Chris. Thank you.
To the foods you're eating. Meal by meal, snack by snack, you write down everything. All the junk food, and if you have a hamburger that has mayonnaise, you write hamburger plus mayonnaise plus cheese for the cheeseburger plus tomato. And that way we can see what you're eating. Then what we do is we have them correlate their symptoms according to the type of weather it is, according to the time of day. And that way maybe at the end of a week we can see that maybe during the course of the week this person ate 60 items that have sugar in it. One good question we ask them is say, look, if you had to give up one food, what food would you hate to give up? They say, well, God, I take my coffee, take my milk, but whatever you do, don't take my chocolate. See,
and that might be a key?
Yeah, and they say, well, why don't you want us to take your chocolate? Well, if I don't eat chocolate, I really start getting a bad headache. So in other words, they eat chocolate to make the headache go away. So in other words, they're addicted to chocolate. Now we're coming back to the food addiction thing again. Let me give you an example. I had a lady who came in. She brought her daughter in for her tonsils. Take out the daughter's tonsils. The lady has this funny splint on her finger. I said, what's that? Is that a ring? She said, no, I have arthritis. I have really bad arthritis and it flares up. I said, what's your favorite food? She said, chocolate. I eat chocolate every day. I love it. I drink chocolate milk. I eat chocolate candy. I said, do me a favor. It's not going to cost you anything. For 4 days, don't eat anything at all with chocolate. Get it out of your system. I said on the 5th day, overdose with chocolate. See, and what happens is after 2 or 3 days, the chocolate's out of your system. On the 4th day, you should be feeling pretty good. Now you're in a position where you're going to overreact to an overdose of the food in question. So on the 5th day, we give them the chocolate, and I said, she came back a week later, I said, what happened? She said, the first 2 days I felt bad. That means she's going through withdrawal symptoms, right? 3rd and 4th day, she starts feeling better. On the 5th day, she eats a lot of chocolate, and her hands started swelling and getting red. So it didn't cost her anything. I didn't do any tests. Didn't involve anything other than having the patient become aware of what she's doing, and that's called a challenge feeding test. We're challenging her with a specific food. And she learned something. She learned something.
Absolutely fascinating, Doctor. I wish we had a lot more time. I know a lot of people have been very, very intrigued with what you've had to say. You don't have a book I can plug.
No, but I'm thinking of writing one.
Well, please, if you do, let me know, and I will pass it on, because you're very perceptive and you're very humorous. We've had a great time with you. Before we went on, he's telling otolaryngological jokes. I didn't say that right, but I only have a minute left, or you could tell one.
That's fine.
But you've really been fabulous. Thank you very much, Doctor.
Okay, thank you. It's been a pleasure.
Thank you. And stay with us, because we're coming right back.